So we are using a new policy which has been prepared nationally. Officially the title is called Supporting Patient Choices to Avoid Long Hospital Stays. However, people who have used a policy similar to this in the past may have known it referred to as home of choice. So the policy itself is around supporting the patient choice, as it says in the title. So when patients come into hospital, we will support their acute treatment, but we will also be communicating with them about the next steps around discharge planning, and it is intended to support the patient to leave hospital in a timely, safe, effective way, whilst appreciating that the patient's preferred choice may not be readily available. So there are a number of staff involved in the policy, not only those members of staff that work on the ward and are employed by the hospital, but also social workers and healthcare professionals who are employed to support the discharge process. So staff on the ward, it's about being open and honest with our patients and communicating what's happening at each step of the patient's hospital journey, welcoming the patient to our hospital, verbally explaining to them, all the relatives if appropriate, what can be expected of their journey. When it comes to discharge planning, the professional leading on discharge will be communicating to the patient, and again if appropriate their relatives, family, what is expected then of the next steps for discharge. Now it may be that the person's preferred package of care or preferred placement, as in 24-hour care home, isn't available. So it's about that member of staff communicating out what will happen to support discharge, and that will be that the patient will be discharged to a different care home or with a different package of care, and that package will meet the person's needs. We will recognise that it isn't the patient's preferred choice, but we will then work with the patient when they are discharged so they get their preferred choice in the end. We will not just close the door on the patient when they're discharged from hospital and leave them up to find their own preferred choice. That wouldn't be fair, and it's certainly not supportive. When a patient is medically optimised, i.e. they no longer need NHS acute treatment, we need to discharge them from hospital for a number of reasons. One is around when somebody is well in hospital, they are susceptible to hospital acquired infections, which can then have an impact on them physically and will increase their length of stay in hospital and can be detrimental to them. Secondly, it's around a physical decline, so around mobility. If you're over the age of 80 and you are in hospital longer than 10 days, you are at risk of muscle wastage of about 10 years. So that's 10 years of muscle deconditioning. It's about as well the experience for the patient and their relatives. So it's not nice for anybody to be in hospital when they don't need hospital care. And the bigger picture is around flow, and patients who are acutely unwell needing hospital treatment have to be admitted to hospital, and at times we struggle to find a bed that is appropriate to meet their care needs because we are unable to discharge people from beds, which then consequently means that they stay in the emergency department much longer than that's intended for them. And that has an increased risk on their mortality. So we have a new team, Care Home Selection. They are employed by the Trust to support patients to be discharged to care homes. So when we have a patient who requires, as an example, nursing level of care and their preferred choice isn't available, we will use our care home selection team, who will be there to source the placement from the start, but we will use them to support the patient to be discharged to perhaps a home that isn't of their preferred choice, although it will be able to meet their needs. And then when the patient is discharged to that home, care home selection will keep working with the patient so they can achieve their preferred place of care in the end.